Sylvie Rousseau. I'll be your moderator for today. I am the Outreach, Social Media, and Communications Assistant with GHFP-II here at the Public Health Institute. Today, we'll be going through a few presentations, and we'll have a question and answer segment at the end of our presentation. Please be advised that poll questions will appear throughout the presentation, and we will invite you to respond to those poll questions to make it a bit more interactive. Throughout the presentation, we'll be reminding you that closed captioning is available. If you look in the column on the right, we have a box called the Media Viewer. The Media Viewer allows you to see the real-time transcript of the spoken content of this webinar, and this may collapse from time to time as different panels come up on the right-hand side. One tip is to click Show Hide Header in the Media Viewer. That will make your screen a little bit bigger. And if that window does collapse, you'll just click the little icon that looks like a film strip coming up through a pie chart, and you'll be able to see the Media Viewer once again. If you have any technical difficulties, please don't hesitate to contact us. Joanna Hathaway and Tanya Hammond are with us from Dialogue for Health, and they are helping with the technical side of this presentation. Please take a moment to write down this phone number, 1-866-229-3239. This is a way for you to contact these two ladies if you're having trouble. Another way to get help is to use the Q&A function, question and answer, over also on the right-hand side of the screen. So when you submit questions through the Q&A feature, you can submit technical questions or questions about the presentation. Please submit to all panelists. So for today's presentation, we have with us a number of people from the Public Health Institute and also from the Drexel School of Public Health. We'll be introducing them as we move forward. And I'd also like to introduce, once again, the polling feature. So the polling feature will be that way for you to give us feedback during the presentation. Please, when this feature becomes available, choose your answer and click Submit within the time allotted. And with that, we'll move right into poll number 1. So the first question that we'd like to ask is, how familiar are you with Global Health Fellows Program 2? Are you very familiar, somewhat familiar, not very familiar, not familiar at all, but you'd like to know more? And you can start answering those on the side. The next question, poll number 2, which statement best describes you? I'm not sure if I'm on the right track for global health. I need practical advice about how to move forward. I'm committed to global health and know what I need to do, or something else. And then for other, please type your answer in the Q&A box and submit to all panelists. So you have a couple more minutes to answer polls 1 and 2 on the side. And I did want to mention that we have colleagues joining us today from Washington, D.C., from Oakland, California, and from Philadelphia, Pennsylvania. And we have people registered to join our webinar from all over the country and a few countries outside of the United States as well. So welcome, everybody, and here we go. First, I'd like to introduce Bob Leone, who's our lead for Outreach and Communications here at the Global Health Fellows Program 2. Bob?
Yes, thanks, Sylvie. One of the ideas we're hoping to get across today is that there isn't a single answer to this question, what is global health? There are many different aspects to the work, and there are many different kinds of practitioners from varied backgrounds doing that work. In the webinar today, we hope to show you some of the diverse aspects of the global health field and how you might become involved or become more deeply involved. I'd like to start by taking just a quick look at 2 of our former interns. So let's start with Jonathan. Jonathan began his career with a non-health college major, but one remarkable experience he had as an undergrad caused him to turn his attention to global health issues. While attending a seminar on the then-new PEPFAR, President's Emergency Plan for AIDS Relief, Jonathan had a strong reaction that inspired him to travel to Jos, Nigeria for 4 months, despite some misgivings from his family. In his own words, he said, "I found incredible value in working outside my comfort zone." In Nigeria, Jonathan worked in an HIV/AIDS clinic. He remembers, the clinic had just recently received PEPFAR funding and subsequently antiretroviral treatment to provide for HIV-positive clients. "I saw firsthand," he said, "these drugs save some lives, while at least one person a day died in the clinic from advanced AIDS. I worked with the incredibly overwhelmed staff of the clinic in sometimes horrifying conditions." So clearly this was a turning point for Jonathan in his sort of career, thinking about where he wanted to go in his career. Returning to the U.S., Jonathan enrolled in an MPH program. Between the 2 years of study, Jonathan was a GHFP summer intern. "The work I was involved in at USAID," he said, "was so engaging, so relevant, and so inspiring that I knew very quickly that I wanted to work on broader reaching programs and policy making." Or let's consider Niquelle Brown. Niquelle is an engineer. She studied industrial engineering and health systems, earning her bachelor's and master's degrees at Georgia Tech. According to Niquelle, the international development community needs engineers, mathematical modelers, statisticians, and epidemiologists just as much as it needs experts in health behavior, international affairs, and social work. Niquelle became a GHFP intern and worked on 3 main projects during her commodity security and logistics internship. One was the analysis of the shipment network for reproductive health commodities and identifying opportunities for improved efficiency. A second was a statistical analysis of the correlation between volume of commodities and prevalence rates of contraceptives in USAID priority countries. And third, she developed a supply chain evaluation tool for those priority countries. One thing she learned during her summer in Washington, D.C., among many other things, is that all of USAID's work and all global development work really is highly contextual. Family planning brings another layer of sensitivity into the equation. After her internship, Niquelle enrolled as an epidemiology PhD candidate at USC. So I'd like to give you just a little bit of an overview of the program. GHFP-II works with USAID by recruiting, placing, and supporting both fellows and interns to work with the agency in Washington, D.C. and overseas, and also by providing them with essential career and professional development support. Currently, we have about 120 active fellows on the program, and there will be a cohort of approximately 40 summer interns who will be starting with us at the end of this month in the Global Health Bureau in Washington. We also work with other organizations, including GlobeMed, who provides developing country internships at the undergraduate level. For more information about GlobeMed, you can visit their website at globemed.org. We also partner with Global Health Corps, an organization that provides one-year developing country fellowships for early career professionals, and their website is ghcorps.org. A little bit more about the fellowships. These are the more senior level positions and are 2 years in duration, often with an option to extend for an additional 2 years. These are fully paid and benefited positions at different levels of expertise. And all of our openings are online at ghfp.net. And this slide just gives you a little bit of an overview of what we do, the locations, and when. So we're currently midway through a 5-year cooperative agreement with USAID, which will end in 2016. As you can see, fellows and interns have worked in a variety of locations. Countries listed in regular text are those where we've had or currently have fellows, while those countries in red are where we've had both fellows and interns. Lastly, countries listed in blue are those where we've had interns only. These are some of the technical specialties that our fellows and interns are involved in. As you can see, it's quite a broad range. If it's part of global health, chances are we have a fellow or intern working in that area. And then to wrap up my section, I just wanted to talk a little bit about the internship, since I know many of you are students out there in the audience. Our summer internships are for a minimum of 12 weeks. These are compensated, and the interns are based in Washington, often with overseas travel as part of the experience. There are also several on-demand positions that come up throughout the year. And those can go up to a maximum of 6 months. And the way that internships work is that you apply for a specific internship, not to the internship program as a whole. For next summer, the positions will be coming out in late fall of this year for 2015. And I wanted to just kind of leave you with one thought as something to think about, especially for those of you who are very early on in your career. There will be in an employer's mind an overarching concern. Will this candidate be able to take what they have learned in school and apply it to the work environment? So can he or she make a successful transition from academia with one set of demands and goals to a professional job with a differing set of priorities? So those things will be discussed in more detail later on. And so that's it for me. Thanks very much.
Thank you, Bob. I was hoping to ask now, Tanya, could we please pull up the results from polls 1 and 2? So you'll see everybody on the right-hand side, the polling box is now back up, and we have the results from polls 1 and 2. So it looks like most people have some familiarity with Global Health Fellows Program 2, and the statement that best described most people was that they need practical advice about how to move forward. So great, we have a lot of that coming forward. We are now going to move into polls 3 and 4. The first question we're asking is, are you now or have you been involved in a student organization with an international focus? Yes, no, no opportunities existed at my school, or no, I was not able to participate. Poll 4 asks, how difficult do you feel it is to fund your international experience and travel? Is it very difficult or very manageable to fund that experience? Is it manageable, difficult to manage, or impossible to manage? So for these two questions, we ask you to participate on the right-hand side, and you have about 3 minutes to answer polls 3 and 4. And while you're answering those polls, we will remind you that the Q&A feature is accessible throughout the presentation. Any technical questions or content questions can be addressed to all panelists, and we will use these in our Q&A at the end. And hopefully some of these questions will be answered also throughout the course of the presentation. Another reminder is that we have closed captioning available in the media viewer window. The icon for the media viewer window is the circle with the film strip, and you can bring this up to see a live captioning of the words coming out of our mouths. All right, now we'd like to introduce Dr. Warren Hilton from Drexel University School of Public Health. Dr. Hilton is the Associate Dean for Student and External Affairs, and he's also the co-director of Opening Doors Health Disparities Research Training Program. We're excited to have Dr. Hilton with us today, and without further ado, please welcome Dr. Hilton.
Thank you, Sylvia, and thanks to everyone who's joining us today. I'm going to talk about, from the university perspective, a few things here today that would be relevant to both individuals who are currently students, and even if you're not a student and have moved on in your career, things to also think about. First, I'm going to talk about some popular misconceptions that I hear all the time from students and professionals about getting global health experience. I'll talk about how to prepare for international travel, ways to fund international travel. I'll talk about some information for non-U.S. citizens, because oftentimes I have folks who are non-U.S. citizens express frustration and concern about not being able to get global health experience if they're being educated in the U.S. Because many of the opportunities are funded through the U.S. federal government, which does not allow them to participate. So I'll talk a little bit about that. And then I'll end by talking briefly about some ideas around career development and how to use your global health experience in terms of your career. So let's talk about some of these misconceptions that I often hear. Number one, I often hear people say that you have, in order to get global health experience, you have to have previous international travel experience. And while that certainly having previous international travel experience is great and wonderful and a feather in someone's cap, it does not mean if you do not have that previous international travel experience that one of these opportunities, whether it be a volunteer opportunity, internship, or fellowship, is not available to you. And I'll talk a little bit more about how to prepare for these experiences, especially if you don't have international travel. But we have had a number of our students here at Drexel and certainly at many other universities who have come to us and not had any international travel experience in their background, and we were able to plug them in to opportunities like the Global Health Fellows Program and others. Second misconception, you must have a lot of money to travel. And certainly, I guess we all would want more money rather than less money, but your status in terms of wealth does not prohibit you from traveling abroad and being active in global health opportunities. I'll talk a little bit later about how to fund these opportunities, but certainly for internships that are paid and fellowships that are paid, these are opportunities where you're actually going to receive some compensation to go abroad. And then there's, like I said, I'll talk about some of these ways to fund it in a second. I must volunteer. That is the only way for me to get this type of international health, global health experience. And as Bob has already talked about, there's many compensated opportunities there. I often get people who come to me and say, well, I should only apply for competitive opportunities where there's an extensive application process and screening process. And there are some very interesting and good international health opportunities out there that are on the volunteer basis, where you simply, you fill out an application, and as long as you meet a certain minimum criteria, you're selected. So there's lots of ways to get experience. It doesn't necessarily have to be through one of the competitive application process for the many organizations that offer these type of opportunities. The only way to go abroad, to have an impact internationally, is to go abroad, and that's a popular misconception as well. Certainly there's immigrant populations wherever you're at, whether it be in the U.S. or abroad, that you can work with and get that type of global health experience. I'm in Philadelphia, and just right outside, I was just looking at the city, the health commissioner's report, and right outside my doors here in West Philadelphia, there's a large African immigrant population. Philadelphia also has a large Irish immigrant population, Italian immigrant population, Mexican immigrant population. So you don't necessarily have to travel internationally to have an impact on global populations. And then work experience is the only valuable international travel opportunity that exists. And that's certainly not true as well. There's plenty of volunteer opportunities, study abroad opportunities, even going to international conferences and things of that nature are all excellent opportunities to go abroad, do some international travel, do some networking, which we'll talk about in a second, and get experience and prepare yourself for an international travel experience in global health. So I believe at this point we'd like to see the results from polls 3 and 4. And if I am seeing this correctly, the answers to the results for the first question are are you now or have you ever been involved in an international organization? Most people said yes. And then in terms of funding, how difficult people felt it was to fund international or global health travel experiences, the majority of folks said that it was difficult to manage. So certainly we will talk about these issues. So in terms of preparing for international travel, I always talk to people about making sure that you are aware of what's out there and that you educate yourself. If you're on a university campus or if you graduated from a university, your institution probably had a study abroad office or some office that coordinated international travel. And that is an excellent office for you to educate yourself about what opportunities out there exist to travel abroad, how you can potentially fund those opportunities, as well as understanding more about what do I need before I go abroad, and we'll talk a little bit about that in a second. Also, talking to your peers and others who have traveled abroad, hearing what their experiences are very enlightening to folks. It helps to kind of change some of the misconceptions that we often have about traveling abroad when you hear from others who are similar in terms of status. You know, if you're undergrad, talk to other undergrads. If you're a graduate student, talk to grads. If you're a professional, talk to professionals. So talk to peers and others about traveling abroad. And then on college campuses, there's a wealth of faculty and advisors who have a wealth of information here on campus and on your campuses, wherever you might be if you're an undergrad or graduate student currently, that can give you a lot of information about, you know, what you need to be thinking about for an international travel experience or a global health opportunity. The next thing I'll talk about in terms of preparing for international travel is to make sure that you get involved on your campus. If you're on campus, joining global student groups. Bob talked about GlobeMed, for example, excellent group. There's the Global Health Brigades. There's a number of other organizations that are out there that are kind of national and regional. Or if it's just a group that formed on your campus or something that you're interested in, certainly think about maybe forming a global student group if there's not one on your campus. And these are very valuable opportunities to engage with your peers in an effort to learn more about international travel, global health, and those type of topics. And then, as I said earlier, one powerful way to get involved without even having to go international is to work with an immigrant population in whatever area you're in. Because you can get some of the experience that will prepare you for international travel just by working with that population here. So, for example, a couple years ago, I had a student who wanted to travel to India, and I said, well, before you travel to India, you may want to get some exposure to what are the particular health issues, what are the cultural issues that you might not be aware of. And I think the best way for you to do that is to work with some of the immigrant Indian folks who are here in Philadelphia. And the student did that, and it was a very enlightening experience for them, and ended up being able to travel to India for a global health internship. And then also, educate your family and friends about travel. Often, if we don't have folks in our family who have traveled abroad, who understand global health and these type of opportunities, they might have some of the misconceptions that we had, and they might have even more issues around, is it dangerous, is it something that's going to be detrimental to you, and things of that nature. So begin to educate your family about where you're thinking about going, what the experience will be like, what you heard from the Study Abroad office and peers and faculty and advisors, and summarize that information to help your family understand as well, what this international travel experience is going to mean to you. And then think about your career and life goals. I want to talk about reverse engineering in a second when I talk about career development, so I won't spend a lot of time on that. I'm going to talk about developing a funding plan. And then also think about reentry. How do you internationalize your life when you come back from an international travel experience. Oftentimes I work with students who come back from an international travel experience of 3 or 6 or a year, 3 or 6 months or a year or 2 years, and they often find it difficult to kind of get reacclimated back into the U.S., for example. And so how do you internationalize your life? You should be thinking about that. Can you work with an immigrant population? Can you still be in touch with the folks that you work with abroad? And what other opportunities in terms of careers will you be able to participate when you kind of re-enter into the environment that you were in? So the million-dollar question is funding. How do I fund international travel, global health opportunities? And so, as I said earlier, competitive opportunities are often paid, and many of them include travel and housing assistance. But if you're in an opportunity maybe where you're volunteering or it's experience where you're studying abroad and so forth, there are many options that colleges and universities have in terms of funding. Sometimes your tuition can be applied. If you have, for example, a scholarship at your home institution, sometimes that scholarship can be applied to study abroad programs and those type of experiences. And then I have some examples from Drexel that I'll show you in a second. And then there's many offices on campuses here at Drexel. Our Graduate Studies office, for example, has travel awards for students who present at conferences, whether it be in the U.S. or abroad. Our Office of International Programs has international travel awards and things of that nature. And then for tuition-based programs like study abroad programs and experiential learning programs that have tuition, oftentimes, as I said earlier, some of your scholarship aid or your financial aid that's from your institution can actually travel with you depending upon your institution. So you should ask your financial aid office if you're at a college or university now if that's an opportunity for you. And then fundraising is certainly another opportunity, and I'll share one example with you in a second. And then a special note, make sure you understand the currency exchange rates, traveler's checks, and those type of things. Some countries you go to, the ATM fees are higher than they are in the U.S. Sometimes the currency exchange is not exactly what you think it might be, and you want to be aware of all those things before you commit to a travel opportunity. So here are some funding examples. The first one is Love Abroad. It's a group of 5 students a couple years ago here at Drexel who started this blog, and you can actually go to their blog. It's still up. And their way of fundraising was they started this blog and they got people interested. They talked about what their experience was going to be, what they were anticipating, and that was their vehicle for using to fundraise. And they actually shared while they actually were in the Gambia, share their experiences in the Gambia, and again, to give people an idea of what it is that was happening and also to raise funds. I talked about, there's university and college options like courses that involve international travel. One of our courses here, our Global Health Integration Module and Field Practicum Experience, is offered every summer to individuals who are at the graduate level at any institution. And it's an online 6-credit course, but it includes a 2-week travel opportunity that's built into the tuition. So the tuition for those 6 credits covers your travel, so that's a potential way to fund it. And then we have Study Abroad sponsored, where, as I mentioned earlier, where your financial aid and your scholarships and your loans and so forth can apply. There's even a position funded by our federal work-study funds that allows students to earn money while abroad. And then I mentioned the International Travel Awards that are like our Office of International Programs. And I've given you Drexel examples, but most colleges and universities have these type of funding opportunities. And then, as I said earlier, a special note to non-U.S. citizens, then I'll wrap up with some ideas about career development, that you want to be aware of citizenship requirements when you're applying for these opportunities. You want to consult with whatever office on your campus serves non-U.S. citizens to make sure that your travel is in line with your visa status and doesn't do anything to detrimentally affect your visa status as a student. And then think about opportunities in your home country. Many of our students from India, from China, from Africa, we often work with them to connect back to their home country for these experiences. So working with, for example, their ministries of health so that they can get some funding as well. And then I'll end by talking about career development. When you're thinking about international travel and global health opportunities, I talk to people about reverse engineering. So think about what it is you want to do down the road and how does this experience fit into it. So a lot of times we go into these experiences and we say, I just want to do some international travel or I want to do global health. And that's okay, but a better way to do it is to think about, well, where do I want to be 5 years or 10 years from now? What type of career do I want to be in? And then think back to what type of experiences will I need to be in that position, and then try to develop and secure an international travel or global health opportunity that allows you to move towards that goal. Be open to new opportunities. There's new opportunities for these type of international travel, global health opportunities come open all the time. We have a Global Health Opportunities Day, which the Public Health Institute participated in and participates in every year. And I can't tell you how many students come to that and, say, you know what, I wasn't going to come to this, but I'm so glad I did. So be open to these new opportunities, network, meet as many people as you can who have done these type of experiences or who are working in organizations that have these type of experience. If you can, find somebody who's a mentor, who can serve as a mentor to you to kind of help you navigate, these type of experiences, what it's going to be like, things you should be thinking about. And then I'm not going to get in depth in terms of talking about resumes, but be sure to clearly articulate your international experience on your resume. Oftentimes I see students, they put study abroad, West Africa, and that's what they put on their resume. But you need to be more detailed and talk about, well, what that experience involved, and again, thinking about reverse engineering, how does that experience relate to where you want to go down the road. So thank you for your time and allowing me to give you the university perspective. And at this point, I will turn it over to Dr. Fred Fuentes.
Thank you so much, Warren. That was really interesting examples of funding opportunities and ways to reverse engineer the Abroad Experience program. I'd like to introduce now Dr. Fred Fuentes, who is our lead for inclusion and diversity here at the Global Health Fellows Program 2. Before that, he was actually doing his doctorate at Texas A&M University Commerce. And before that, he was actually a GHFP fellow in Guatemala. He will share his own unique story about getting into global health. Fred, go ahead, please.
Thank you, Sylvie, and thank you, Dr. Hilton. I would imagine that participants are already thinking about implementing some of those ideas that Dr. Hilton just shared. Let's see here. So what does a fellow look like? As you begin to draw out or think about those images of what a fellow looks like, we can summarize by stating that there are no two fellows that look alike. This doesn't mean that we're not specific about the types of candidates that we seek. Instead, we work hard to ensure that a diverse group of candidates represent our organization and our country as they work in DC and international settings. Keep in mind that applicants with the most experience aren't always the best candidates. As in the case with internships, we seek those who might gain the greatest benefit and from whom USAID and partners will gain excellent assistance and fresh perspectives. Fellowships, however, are more about your experience and your expertise that complement the scope of work for each particular announcement. While it may be daunting to know that you're competing amongst the most competitive fellowships in global health, we'd also like to reassure you that your experience, transferable skills, and ability to share your story are all variables that are considered. But back to the question, what does a fellow look like? We hope that at least one looks just like you. So let's look at one of the fellows, Dr. Tom Easley, one of our current fellows, and reflects our representation of the work that we're doing, providing opportunities to serve in developing international environments. Dr. Easley lives in Uganda and works out of the USAID mission in Kampala. He reflects a non-traditional fellow in that he is a U.S. military veteran and left his previous occupation to become a fellow, much in a way that represents our mid-career changers. Tom's military background gave him an initial experience with public health, and as a result of that experience, became interested in working in a more sustainable way in the field. He's a senior technical advisor as a veterinarian working in emerging pandemic threats and has lived and worked in Uganda for many years. Dr. Easley contributed to the control and containment of avian and pandemic influenza in Nigeria, Egypt, and developed and implemented veterinary infectious disease, food hygiene, sanitation, health and wellness projects in Ethiopia, Somalia, Kenya, Eritrea, Uganda, Tanzania, United Arab Emirates, Oman, as well as the United States. So let's talk about the many roads to global health careers. You know, this is an excellent visual representation of the roads and paths that we travel en route to our careers in global health. As reflected in this slide, there are many examples of potential paths to opportunities, whether that includes the most popular avenues, such as Peace Corps, newer opportunities, as mentioned by my colleagues previously, undergraduate student involvement in GlobeMed, or volunteering locally at a sexual health clinic in your community. One example of a unique entry to global health is a mid-career changer, as previously shared about Tom Easley. For example, they're defined as candidates with several years of experience outside of global health, currently enrolled in a relevant graduate program with considerable transferable skills. Examples of mid-career changers include maybe a social worker with 10 years domestic work experience, perhaps a person whose main experience in the U.S. domestic programs. Keep in mind that equal consideration is given to mid-career changers in the internship review process. So let's talk about maximizing our resources. Sometimes it feels like that we are in, or we actually live in, a low resource area. If this is the case, it's important to consider how to maximize those limited opportunities. This is true about life just as much as it is about careers in global health. And you know, here at GHFP-II, we're always amazed at the creativity of our applicants who may live or work in low resource areas in the United States and around the globe. In my case, as with so many of our applicants or people listening today in the webinar, we started from traveling down a non-traditional path. Just as with the concept of diversity, the vast definitions that are open to one's perspective, so is the understanding of non-traditional path. In my case, I interpret this as the beauty of unpaved roads, filled with character, movement, and a path unseen by previous travelers. Non-traditional paths reflect the navigation of our careers through experiences that may be unique to our careers, unique to our region, or unique even to our culture. So among the resources available to you, I wanted to share that GHFP-II has informational sessions, resume consultations that we can do over the phone. This will help you in structuring your documents and answer some of the questions you may have. So for more information, definitely visit our website at www.ghfp.net, and that will help you maximize those resources as well. So let's talk briefly about why inclusiveness matters. You know, this webinar is an exercise in inclusive strategies. Just as my personal experience reflects, inclusion involves various components or paths that we all take to accomplish our goals. It's the idea that we work diligently to ensure that everyone is part of the decision-making process. Just like my colleagues at GlobeMed say, nothing about us without us. And this is a wonderful reflection of ensuring that we're all included and that we will also always include. At our office, we implement strategies that ensure that we're always inclusive of our applicants. The power of diversity. As stated previously, we extend invitations to so many of our contacts with HBCUs, HSIs, and MSIs in general, as well as schools with high levels of minority students. We recognize that team effectiveness increases creativity, more open thinking, and challenging of long-held beliefs, resulting in fewer blind spots and improved decision-making. simple question, not so simple answer. Who's not at the table? Whose voice is not being heard nor shared at the table? As a result of our key diversity strategies, focus on race, ethnicity, geographic representation, as well as other crucial areas to our success, the adaptability of our candidates, future interns, and fellows is measured by the range of talent, experience, knowledge, insight, and imagination available in the workforce. This is evident with our partners and collaborations, as in the case with Drexel University, who have worked hard to reflect this similar strategy that we have. Let's talk quickly about distance traveled. This is for us, it's the consideration of the whole person, not just demographics. The idea captures the ability of an applicant to overcome an array of life challenges. You may be part of a diverse group that we seek, groups that represent the American people. As an example, individuals from low-income, ethnically and culturally diverse communities in the United States may be more attuned to the practical realities and motivations of people in urban and rural communities in the developing world. And really, we're all served by attracting the best available talent, communicating its priorities to academic institutions, and developing strategies to cultivate and retain that talent. This is of particular importance as we provide opportunities within our 3-month summer internships as well as our fellowships. So let's talk about the importance of community. Academic and work environments with a critical mass of diversity will be more effective when they bring out the benefits of diversity. This is particularly important when we serve within our community. The thought is that local is global and global is local. Therefore, it's important to serve our communities as it is to serve our partnerships around the world. Appealing to the next generation is an important strategy as it allows us to go beyond what it does for ourselves or the institution. You'll begin to see what your service and your achievement do to advance your community, yourself, and your university or the place you work. An example of creating opportunities for diverse groups includes the Sophomore Experience, collaborative effort between GHFP-II and Texas A&M University of Commerce, and as seen here in this image. So we were creative in this implementation by providing the first international travel experience that provided rural university undergraduate students with their first exposure to public health and global health opportunities. A small group of diverse students traveled to Central America and provided a public health hand-washing campaign to hundreds of elementary and middle school students, forever affecting both parties, the local school children and the university sophomores. So, as with the lottery, you can't win if you don't play, right? So such is the case with our internship and fellowship opportunities, easily among the most competitive, worthwhile opportunities in global health. But you have to apply to be considered. Of course, before you can be considered, there's some things that you need to have in place. You need to be sound and ready professionally, whether that means an appropriate online profile, resume, work or volunteer experiences. We remind you to be creative in reflecting the work you've done. Remain positive as you share your experiences, but be realistic. Ensure that you're filling in those time and space gaps and demonstrate those unique values and contributions. So everyone's wondering, what does a fellowship look like? Well, just as when I talked earlier about the fellow, fellowships are equally varied and do not reflect one type of person or experience. In fact, each is based on where the fellowship is located, who's hosting, the level of expertise expected. One great way of learning is visiting our website, getting familiar with the language we use, the types of agencies that are hosting, and visiting their websites as well. Also, while on our website, visit the fellowship opportunities, become familiar with the scopes of work and those expectations. In my case, when I transitioned from the military, I was working for a family planning clinic. And during a visit to Mexico, I was, as part of, with our partner MexFam, I was able to meet an American woman who was working there as a fellow. Intrigued by her work, I asked so many questions, found out how to become part of this, similar to what you're doing today with the webinar. And so what I did was I spent the next year preparing my CV, volunteer experiences and opportunities, ensuring that my strategy fit the scopes of work that they were looking for. And a year later, I applied and was accepted and was able to work with Mercy Corps in the Central Highlands of Guatemala. While the fellowship was challenging, it was definitely life-changing, confirmed that I wanted to work in global health and that I had the resources to be a successful team member. Preparation was key, as well as realistic goals and a strategy that allowed for some flexibility. Okay, so transferable skills. And this was oftentimes the difference between me and the colleagues that applied along with me. How do you share your transferable skills? You know, they are the bridge between global health experience and the communities that we serve. Transferable skills are important, particularly for those of us who have worked or grew up in resource-challenged areas. These skills are of particular importance for so many careers, including our own, as they often reflect understanding diverse social dynamics and working with groups, as well as the ability to have worked within a multicultural environment. Again, these are skills that could be developed during your resume consultation. So don't count out your experience that may be or feel limited when in fact they're creative and unique opportunities to reflect your transferable skills or that distance traveled story. And this is particularly important for those of you interested in our internships. So tell your story. We appreciate hearing your academic accolades, your scholarships, your success, your unique story, and how you've overcome barriers and served your community in the process. And yes, these opportunities are competitive and may involve preparing essays, cover letters, applications, and interviews. Though as an intern applicant, it will help you prepare for the expectations in the field of global health. As for our fellowship applicants, it will help you recognize the importance of a clean and consistent resume with complementary work experiences. Our application process considers applicants' life experiences, circumstances, and personal challenges in addition to credentials. And my colleague, Jennifer Russell, will now elaborate on this process. Thank you for your time.
Thank you so much, Fred, and thanks for sharing your story of distance traveled. I did want to take a moment to remind people that Q&A is still available for any questions you have. We're getting some good questions in, saving some up for the question and answer segment at the end, but we are answering a few as we go along. I also wanted to remind you that the media viewer at the bottom right is available to view the live captioning. With that, I will introduce Jennifer Russell, who is our recruitment coordinator here at the Global Health Fellows Program 2. Jennifer has been with GHFP-II for several years, screening thousands of resumes. And take it away, Jennifer.
Well, thank you, Sylvie, and thanks to everyone attending this webinar. As Sylvie mentioned, my name is Jennifer Russell, and I'm the recruitment coordinator for the Global Health Fellows Program. I'm here to talk to you about using and building upon the tools that you already have in your global health toolbox. So when I was preparing my presentation for this webinar, I looked at the registration data to better gauge who would be in the audience. What I found in looking at the data is that all of you represent a range of experience in global health, from students just beginning your careers to individuals with 5 or even 10 years of experience to mid-career changers transitioning into global health. We also asked each of you to identify the biggest challenge you face in pursuing a career in global health. What I found to be most interesting is that there wasn't a dominant issue selected by each career stage group. Rather, each group identified a number of challenges that they face. For example, both students and more seasoned professionals both identified challenges like not knowing how to best present skills and experience, or not knowing where to look for opportunities. So these challenges that each of you face, in a sense, are universal. And this is a great opportunity to come together and think about the ways that we can overcome some of these challenges. So the first thing that I want to do is to talk to you about focusing your passion. And by that I mean, in what areas of global health are you developing your technical expertise? This may seem rudimentary, but I think that it's incredibly relevant, regardless of where you are in your career. for students and more junior professionals, you may not know where your passion lies. It's really important for you to take the time to explore your interests, identify what areas of global health you're passionate about, and then concentrate on building up your expertise. From my experience recruiting in global health, there are limited generalist positions, so you really need to figure out in what areas of global health you want to develop your expertise. Family planning, HIV, environmental health, there's a lot of options, but you cannot be an expert in all of them. For more mid-level and senior professionals, focusing your passion not only helps you target the jobs and opportunities that are most relevant to your background and interests, but it also helps you better brand yourself as a technical expert. I look at a lot of resumes and cover letters every day and see many people who have great experience but haven't done a good job of demonstrating their expertise. The better job you do of branding yourself in your application documents as a technical expert in a certain area or areas, the more likely you will be to end up in the yes pile. Regardless of where you are in your career, informational interviews can also be an incredibly useful tool. When registering for this webinar, many of you identified that you aren't sure where to look for opportunities, or that you aren't sure how to navigate the transition from academia to a work environment. Speaking with professionals already in the field can be a great way to troubleshoot these issues, as they can offer a fresh yet seasoned perspective. Informational interviews can be a great means for exploring your particular career path, practicing your interviewing skills, building networks, getting resume feedback, and gathering information about a particular organization you're interested in. Informational interviews and networking really go hand in hand. You'll want to think about reaching out to people who are already in your network as well as people outside of your network. So let's start with someone inside of your network. Using the Q&A feature on the right hand of your screen, type somebody who's already in your network that you'd like to reach out to. You can just kind of type it in the box and make sure you send your response to all panelists so that I can see them. Again, think about somebody who's already in your network that you'd like to reach out to, and maybe, try to arrange an informational interview or, set up a meeting, see if they have ideas for other people you can reach out to. Okay, that's great. So somebody mentioned previous employers. People are thinking about some specific names as well. Colleagues with international work experience. All right, great. I mean, I think thinking about people who are already in your network can be a great place to start as far as building your network. All right, so let's think about somebody who is outside of your network. Building your network takes both time and research. So you really want to think about what other organizations are out there that you might be interested in working for, and and figuring out who you can reach out to at that organization is another great step too. So that's great. Some of you are already sending some things in. So USAID, so that's great. If you have other ideas too, other organizations, you can type it into the Q&A. Foreign Embassy, FHI 360, let's see, World Public Health Association. Yeah, so these are really, really great ideas. So you can start doing some research on the organizations, or if you already have done some research, that's great too. And start figuring out, somebody who works within that organization that's doing the work that you're interested in, and, figuring out how you can reach out to them. And, kind of doing this research can take a lot of work, but the more people you speak with and connect with, the easier it will get, as you're also able to get referrals from the people that you speak with. So it's kind of like a snowball effect. And this is just kind of an example here of how you might approach somebody. I think, as you reach out to people, not everybody will respond to you. But if you reach out to them in kind of a more curious way, you'll be more likely to get a response. It can feel intimidating, but, don't be afraid to reach out. So here's just an example that I threw together, just in this example, I stated that I work for the New York City Department of Health and Mental Hygiene, where I work on HIV/AIDS-related programming, and that I was interested in transitioning to international health. So, just be courteous and direct, and it kind of give a reason for why you want to speak with this person. So remember, as you're trying to set up informational interviews, that these are informational interviews, not job interviews. However, just like any other interview, you do want to be prepared still. So prepare your questions for the person in advance, and be sure to research the organization they work for. So here's some examples of questions you might consider asking during the informational interview. And of course, always be sure to ask for any referrals from the person that you're speaking with as well, so you can kind of think about other people you might want to reach out to. So LinkedIn is also a really great networking tool. You can use it to connect with current and previous colleagues, to connect with people outside of your network, and to join targeted global health groups. I'd also like to mention that whenever you join a group on LinkedIn, those people are also added to your network. So it's a great way of kind of expanding people within your network that you're able to then reach out to without having to pay for the kind of in-mail requests. Building a great LinkedIn profile also enables recruiters to find you. I'm on LinkedIn every day, searching for people with expertise in different global health areas. When I see someone who has a complete profile and who has really branded themselves and highlighted their expertise, I'm much more likely to reach out to them about an opportunity. So, when you work on building your LinkedIn profile, if you do a really great job, you can often have people coming to you. So I'd also like to briefly talk about the ways that you can stand out when applying for different opportunities. When applying for any opportunity, it is incredibly, incredibly important that you read through the scope of work, develop an understanding of the position, and tailor your resume and cover letter to the position you're applying to. If you've attended one of our webinars in the past, you've heard us talk again and again and again about tailoring your documents, but I can't stress it enough. Positions can be very competitive. Even if you have good experience, if you submit a generic cover letter or resume, not only is it obvious to the recruiter that you haven't taken the time to craft a thoughtful application, but you're also less likely to stand out compared to the other applicants who did put in the time to tailor their documents. It's also really important that you ensure that your application documents are free of errors. Read and reread your documents before you submit them. If your resume or cover letter contains spelling or grammar issues, or if the formatting is out of whack, your application will be much less likely to make it to the next stage. Remember that your application documents are the first writing samples that the potential employer sees, so you want them to be as impeccable as possible. For our applications, we do not limit the length of resume and cover letters particularly for our fellowships, but it's still important for you to be succinct as possible. Keep in mind that recruiters and hiring managers are very busy and don't have time to read through really long documents. So the don'ts, these kind of are on the opposite spectrum of the do's. Don't apply for positions that you're unqualified for. This may seem like obvious advice, but it's really important that you understand the position and gauge whether or not you are qualified and meet the requirements prior to applying. For example, if a position requires 5 years of experience in international health and you have 2 years of experience, you really shouldn't apply. I also see cases too where a position will require, maybe 5 years of experience in HIV/AIDS and all of their experience is in family planning. They probably shouldn't apply for that opportunity. Just make sure you really read through the requirements and that you meet them before you, take the time to apply. And then, similar to what I spoke about before, don't be generic in your resume and cover letters, and don't submit sloppy materials. One of the ways that you can also stand out with your application is by detailing your experience in your resume and cover letter. It isn't enough to simply list that you have research experience or psychosocial experience. You really need to paint a picture for the recruiter and highlight the details that help you stand out. So here's some good examples on this slide. What I mean by detailing is if you look at the first bullet, they didn't just say that they served in a clinic, for example. They served over 10 hours each week, so that lets the recruiter know that it was an ongoing, pretty big commitment, that they were an HIV/AIDS tester, and also the population they worked in. Throughout this webinar, you've heard a lot about the value in working domestically with resource challenged groups. So this person, said that they served at a rural, low-income population in Alaska. And then, of course, stating that they served over 3,000 people each year. So they served a lot of people. So it's those types of details that if somebody had just put that they worked in a clinic, there'd be no way for the recruiter or the hiring manager to gauge the kind of work that they were doing. So always, whenever you can, try to include, a lot of different details. I also wanted to mention that we did a webinar, I believe it was last July, that you can find on our YouTube channel on resumes, cover letters, and interviews. So if you haven't seen it and you're looking for more of this type of advice, I would really encourage you to check it out. So to recap, we've been talking about some of the tools you can use that you already have at your disposal to combat some of the challenges that you identified when registering for this webinar. From focusing your passion, to building your network, to learning how to present your experience in the best ways possible in your applications, and also through LinkedIn. There's a number of steps you can take to move your global health career forward. And before I conclude, I'd just like to take a moment to go over the fellowship application process. We often get the question of how long does it take, a lot of people are curious about the timeline, and there really isn't the best answer because it does vary depending upon the fellowship. But I'd like to give you an overview of kind of what is involved in the fellowship application process. So all of our new fellowships are initiated by USAID. So they'll come to us and request a new fellow, for a different division in a different office within USAID. The GHFP-II recruitment team then works with the hiring manager on developing the scope of work. Once approved, the fellowship is posted for a certain amount of time, usually 2 to 4 weeks. Then once the fellowship closes, the GHFP-II recruitment team screens through the applications and forwards the application materials of the candidates who best meet the requirements of the fellowship. The USAID hiring manager then decides from the forwarded applicants who they would like to interview. So remember earlier when I was talking about tailoring your resumes and cover letters? This is why it's so important, because not only is the GHFP-II recruitment team reviewing your materials, but if your materials are forwarded to the hiring manager, they will be reviewing them too. So once the hiring manager selects who they'd like to interview, GHFP-II schedules the interviews. In most cases, the first round interviews are conducted via teleconference or Skype. If a second round interview is necessary, these are usually done in person. The GHFP-II recruitment team coordinates the scheduling of the interviews, but a panel of USAID staff actually conduct the interviews. So we schedule them, but USAID staff are the ones who actually participate in the interviews. After the interviews are concluded and the hiring team selects the finalists or finalists, GHFP-II conducts reference checks. The USAID hiring manager and team reviews the references and selects their final candidate. At that point, GHFP-II negotiates the offer with the candidate. After the candidate accepts the offer, a background check is initiated. And then after the background check clears, GHFP-II prepares the letter of offer and other hiring paperwork. And finally, once the candidate signs the letter of offer, he or she is transitioned to the GHFP-II participant support team who begin the security clearance process. So as you can see by that kind of long-winded explanation of the process, the hiring process involves many different steps with both GHFP-II and the hiring team at USAID. So it's really often hard to give a great answer as far as how long it takes, because it really definitely varies per fellowship. And then, as far as what we are looking for, I discussed some of these tips in my earlier slides. I'd also suggest checking out, some of our previous webinars, which go into greater depth on crafting your resume and cover letter. And also, we also have some other great resources on our website, so exploring our website as well. So Fred mentioned it before, we do offer informational interviews, so you can find more information on our website on how to sign up. It's definitely a great resource, if you're looking for feedback on your resume or have other questions. And again, the other webinars are also available on our website as well as YouTube. And here's a list of other organizations you might consider as you're looking for opportunities and doing some research. Global Health Council, APHA. There's another number of other organizations you can look at that can also help you as you kind of further your global health careers. And that's it for me. Thanks, Sylvie.
Thank you, Jennifer. You definitely gave us a lot to think about. We're going to take a second just to remind you that we have the closed captioning available in the media viewer. You'll have to pull that window back up if it's been collapsed, but it's still available. And now we are going to move into the Q&A section of our presentation. So final reminder that the Q&A panel will be available through the end of the presentation. Please direct your questions to all panelists. And we have a number of questions that have been coming through, and a lot of these are really great and help us focus on different populations, et cetera. Before we go into the Q&A, we'll have one last poll. So after hearing from a number of different perspectives, we'd like to ask you, what currently is your strategy for starting or advancing your global health career? You have about a minute and a half to answer this question. The answers here are defining, refining my career goals, researching organizations doing work that interests me, gaining additional education or training, something else. And for this question, you can select all that apply. So without further ado, let's move into the Q&A. So you've met most of our panelists through the course of this presentation. One person I'd like to introduce is Jennifer Kaindi, who is our lead for recruitment here at Global Health Fellows Program 2. Jennifer has been working in the international health sector for many years and has some great understanding and great insights to offer. All right. So the first question I'd like to ask is from an audience member here, and it's about a global health certificate. Does a certificate in global health stand out on a resume? And I'd like to ask that to Jennifer Russell.
That's a great question. You know, as far as the certificate goes, it's hard for me to speak on how valuable it would necessarily be with other organizations, but most of our positions beyond the internships require at least a master's degree. So I guess it would ultimately depend on where you see yourself in the future and where you want to work. If you want to work for an organization like ours that you know, is a hiring mechanism for USAID, then I'd say you might consider, you know, getting a master's degree or higher. Or I think as well many of the other positions within the agency also require a master's degree. So I guess I would kind of throw that back and say, you know, where do you see yourself, you know, as you know, maybe 5 years down the road, where do you want to work? And then maybe start doing some research on that organization or those organizations and see what their positions typically require. And if, you know, a lot of them are looking for undergraduate degree or certificates, then I'd say, you know, that's a great choice. But if you want to look for organizations that require, you know, even greater education, then you should consider a master's degree.
Thanks, Jennifer. We have a question about the program itself. So the question asks, since the timeline for GHFP-II ends in 2016, when will the last fellowships begin? And that's a great question because our program is time limited. So I'd actually like to ask Bob to answer this. Bob, since program ends in 2016, how does that work?
Yes, that's a great question. So, and also a little bit difficult to answer at this point in time. However, with my experience in the past and with similar situations, it sort of depends on a few things. But one of the things that seems pretty clear is that whatever happens with this program in 2016, the fellows who are still in their two-year fellowship or the extension piece will be transitioned to another So let's say this program goes away in 2016. Then those fellows who are still on the program will most likely be transitioned to another hiring mechanism to complete their time. Although that's really up to USAID and not up to us, so I can't say that with 100% certainty at this point.
Thanks, Bob. Here's a question that I think you may also be able to answer, Bob. When you're hired by GHFP-II, are you considered a U.S. government or USAID employee?
Yeah, great question. So the answer to that is no, you are not. So there is a distinction there. We're a cooperative agreement with USAID, and the positions that we have are not direct hire positions with the federal government. So what you are is an employee of the Public Health Institute, which is our parent organization. And what that means from a practical standpoint is that your paycheck comes from PHI, your benefits, as a fellow, many fellows do a substantial amount of travel. All of your travel comes through PHI, and also the career and professional development, which I think I mentioned early on, that all comes through the Public Health Institute as well. However, you are working completely within the USAID context and on USAID projects.
Thanks, Bob. Here's a question for Dr. Hilton. If you have student loan debt and want to work internationally, outside of the Peace Corps, are there programs that enable you to defer student loan payment or programs that have student loan repayment benefits?
Yeah, very good question. Certainly Peace Corps and AmeriCorps are, some of the programs that I'm very familiar with that will allow you to defer. The other opportunities, I know there was a question earlier about certificate programs. Our Global Health Certificate, if you choose to do something like that, or another certificate that's a credit-based opportunity, there's some deferral that you can do there as well. Certainly, the federal government has some loan repayment programs or forgiveness programs as well through Health and Human Services. They do have some stipulations along with those in the application process. So those are the ones I'm familiar with in particular, but I know there's probably more out there.
Thank you. Here's a question about mid-career professionals. Jennifer Kaindi, I think I want to ask you this question. Can you give some specific tips for moving into global health as a mid-career person?
Thank you, Sylvie. Sure. So I think a few of them have been mentioned by some of the panelists. First, maybe look at the degree, apply to a program if you don't already have, let's say, an MPH or similar background or degree. And then start either looking for volunteer opportunities, working with the schools as well for whatever programs they have in public health or global health as a way to get started. But I would say the first move would be to get the degree if you don't already have one. If you do already have one, I think Jennifer Russell shared some of the websites that you can go to. Apply for internship opportunities or different other opportunities in some of the organizations that do international development or global health type of programs. So some websites where they offer these opportunities would be on DevX, Inside NGO, LinkedIn, a lot of LinkedIn groups, and being able to network with a lot of people that Jennifer mentioned, finding mentors, finding ways to have information or sessions with some of the people in the organizations that you're interested in applying to. So I would say those are some of the ideas. Thank you.
Thanks, Jennifer. You mentioned finding a mentor. Here's a question about mentorship in particular, and I think maybe Jennifer Russell can answer this. What tips do you have on finding a mentor for a prospective global health fellow or practitioner in global health? How do you find somebody to help guide you?
It's a great question. So, you know, if you're a student, I think it can be a great opportunity to find a faculty who's done a lot of different work in, you know, global health or HIV, you know, whatever area it may be. I know when I was in school, I was able to really kind of go under the wing of different faculty and took on a lot of different opportunities. So I think if you're a student, you know, finding a faculty that's doing work that you're interested in can be a great way to find a mentor. If you're no longer in school or, you know, have finished your degree, I think just reaching out to people within different organizations and setting up informational interviews can be a great way to get different guidance. And, you know, sometimes it's just one meeting, so it's not quite a, you know, a mentor relationship, but sometimes it can be ongoing, you know, depending upon the person and if they're willing to keep kind of being there for different guidance and that sort of thing. And also, you know, to colleagues in different organizations, you know, that you work for can also be a great mentor. So I don't think there's one answer, but I think kind of doing the networking that I was talking about and reaching out to different people can be a great way to if either build a whole supportive network or to find somebody who can really serve as a mentor.
Thanks, Jennifer. Here's a question that I think I'll take myself, actually. Somebody's asking, does GHFP-II offer networking events for interested individuals? And actually, we did just have several events this past weekend. We participated in a networking night with the Global Health Council. And so we may have some other events coming up, and I did want to direct you to our website, GHFP.net, to hear more about different events coming up. And to our social media on Facebook, Twitter, and LinkedIn to stay up to date. I did also want to direct you to the Global Health Council, a group that is going to be focusing its efforts on offering networking and conversation events for different individuals. And also stay in touch with the local networks of global health professionals. So I hope that answers that question. Here's a question about the program again, and Bob, maybe you can answer this. Is there an age limit to applicants? Also, where is the work located?
Sure. I'll answer that question. So as far as the age limit, the answer is no, there is no age limit. So for the fellowships, we have fellows who are you know, relatively early on in their career, on up to fellows that have multiple degrees and 10, 15, even 20 years of experience in the field. And as far as the internships are concerned, there isn't an age limit there either. And I'm sorry, what was the second part of that question?
The second part of the question was, let me find it here. Oh, yes, where are the opportunities located? So where is the work done?
Oh, where's the work, right. Well, for the internships, primarily those are based in Washington, D.C. in the Global Health Bureau. However, many of those will have some amount of overseas travel as part of the experience. And then there are a few, not so many though, of the internships that are based overseas. And then for the fellowships, they would also be based either in the Global Health Bureau in Washington or in one of USAID's overseas missions or with a USAID partner organization. And the majority are based in Washington. However, many of those will have overseas travel as part of the fellowship, some even a significant amount of overseas travel. And that really depends on the position. So each position is different, and it will be written into the scope of work. So if you look at positions, it might say something like, 25% overseas travel required, or even 50%, something like that.
Thank you, Bob. I have a question that I will pose to Dr. Fuentes. Is it possible to have a global health career while married with children?
Yes. Also another great question. I'd love to answer that one. As with many of our opportunities, and my colleague Jennifer Candy could attest, of course, we don't ask those questions. They're not in any way part of the interview, so they don't affect you positively or negatively, knowing any personal part of you or your family. But in the case that, for instance, with myself, then now I'm accepted, the fellowship is now an opportunity. And then, of course, I share, they ask about family size, or any specifics to that nature. But I was able to travel to Central America, full support of the fellowship. It was very pleasant, a wonderful opportunity. I really appreciated the support. At one point there was, a medical emergency. Again, they were able to support myself and my family, but absolutely traveling with your family is encouraged. It reminds me of my time in the military, and there were some spots where we could not take family, but with these opportunities, your family is always welcome to visit or live there with you, and in fact they are supported by our family here.
Thank you, Fred.
Sylvie, sorry, I'd like to also add to that. This is Jennifer.
Please.
For some of these positions, it depends. A lot of the areas that USAID might have projects are safe to have family. A lot of them are. Only a few will they have what will they be unaccompanied posts, and we would post them as such, which means that the mission, the State Department will clarify that that post is only for that individual and not their family, that it's not a safe place for the family as well. That's the only time that we would have such a specification. But most, in the time that I've been here, are in areas where family is supported and is safe, and we will pay allowances to cater for that. Thank you.
Thank you for that elaboration, Jennifer. Here's a question that I think might be addressed to a couple of people on the panel. I wanted to start with asking Dr. Hilton, if somebody had important experience during their college years, would recruiters take this experience into consideration for the total number of years required? And maybe, Dr. Hilton, you can elaborate on the kinds of experience that may be significant or important in the college years, or even at the master's level.
Certainly, very good question. I'll preface my comments by saying that it really depends on the particular recruiter and organization how they determine, what is work experience. But I'll give you an example here. All of our Masters of Public Health students have to do a second year, what we call community-based master's project. And many times what we hear from our alumni is during the interview process, that experience is oftentimes what the employer or recruiter says, got them over the top in terms of getting that position. So, some recruiters will actively, see, a particular type of internship, certainly like the Global Health Fellows Program 2 internships, they would be considered as, work experience most often, but it really depends upon the recruiter. But I think the way to really think about that is to think about how you display that experience on your resume so that it conveys that you did have real work experience to that particular individual, and how you talk about that experience in the application process. As I mentioned earlier, I see all the time students say, traveled abroad to whatever country, and they leave it as that on their resume. And then when I asked them about it, I find out oftentimes, well, they did a number of great things in public health and global health while they were over there for three months, and none of that shows up on their resume. So I think the most important way that I can answer that question is think about if you were that recruiter, and what would you want to see from your experience that would get you over the top in terms of getting an interview and then getting the job.
Thank you. Now I'll pose that directly to a recruiter. Jennifer Kaindi, could you take the same question about the importance of certain experiences experienced while in undergrad or in your school years? Is this taken seriously? Is it taken into consideration?
Yes, and I'll echo the same thing that Dr. Hilton just mentioned. Being able to describe the experience that you have, not just as a little one sentence under your degree, but as actual experience, international experience, if you have it, and clearly describing, the great work that you did. If you worked with children, indicates so. What activities did you do? Was there any? What was the outcome after the program? So all of that definitely counts and will help you stand out. So making sure that you actually write down and indicate clearly what you did as a way to get someone's attention in recruitment or with the hiring manager. Thank you.
Thanks, Jennifer. Here's a question for Jennifer Russell. Jennifer, you mentioned earlier that it's valuable to follow your passion and to specialize in a specific global health area. If you are an early career professional with more interdisciplinary or broad-ranging experience, how would you weigh the breadth of experience versus depth when applying for or when viewing applications for specialized postings?
That's a great question. I think that there's definitely positions that have more crossover. They definitely exist. Whether it's health systems, health systems can be in a lot of different areas. Or we have a position right now, for example, that's working with orphans and vulnerable children, and more specifically in the area of HIV/AIDS. So it's not that crossover in some breadth and experience isn't valued, but at the same time, you still have to have some focus. And if you're early on in your career, you're probably developing that focus, and that's fine. But as you go further in your career, you want to figure out, even if you're specializing in a few different things, you still want it to be fairly focused. So my advice isn't so much, you can only have one thing, but really still stay focused and keep your passion focused and build up your experience in those areas. And I think that's what's really important.
Thanks, Jennifer. This is going to be our last question here. And this is a question that we're seeing from many different people, but we are being asked, what are job prospects for people after being in the fellowship program? What do people do after the 2 years? Do these people go on to participate with USAID in other capacities? What do people do after being a Global Health Fellows program participant? And let's see, perhaps Fred, Dr. Fuentes, you can answer this question.
I could definitely start it, and I know that my colleagues, particularly perhaps Jennifer Kaindi, could elaborate. But certainly those opportunities may exist. For myself, I went back into went back to school to finish my terminal degree. But definitely there were opportunities awarded to me. Just at the time, it wasn't not something I wanted to take advantage of. But for other colleagues, I have seen certainly being offered additional positions or positions locally to work with USAID or the host agency. Yeah, I'd actually like to see what my colleagues, see if they could elaborate on that, see what their experience has been.
Sure. Jennifer Kindy?
Yes. So what we've seen is a number of people are lucky enough to get positions directly with the government, and they become, in most cases, hiring managers for other fellows. Other times, they may go with a different hiring mechanism. And in other cases, because of the networking opportunities and the experience and exposure that the fellowship and even the internships provide, they will end up with the implementing partners. So there are definitely lots of different areas that they end up with, including other donors, governments, and donors such as or institutions such as the UN agencies. Thank you.
Thank you to all of our panelists for your time and your expertise. We are going to wrap up now, and we'd like to invite you to stay in touch with the Global Health Fellows Program too. We have a number of different outlets where we share information, including in-person visits to universities. We are often seen at global health conferences. We offer informational interviews. Please email us at info@ghfp.net with follow-up questions, and join our email list available on our website. Please also stay in touch with Drexel. You can tweet at Drexel Global H and follow them on Facebook. And thank you very much to everybody who came in and joined us from around the world to learn about building your global health careers. Best of luck to you all.